Committee. For the record, my name is Jeff Rhoades. I'm a Senior Policy Advisor to Governor Kate Brown, and my portfolio includes Governor Brown's Addictions and Recovery Policy Agenda and the opioid epidemic, among other things. Since 2017, I have served as the chair of Governor Brown's Opioid Epidemic Task Force, and today I'm pleased to bring you the task force's comprehensive legislative package for the 2019 session, LC 633. One of the things I want to stress is, just as in 2018, the concept we bring in today is both bipartisan and consensus-based, which is something that I'm extremely proud of. In that vein, I do want to say a quick thank you to the amazing members of the task force that have worked with us over these past couple of years, and then others, such as Representative Malmstrom, that have been instrumental in our work. Thank you very much. We can't do it without you. It works. So I have had the pleasure of providing testimony to this committee concerning the opioid epidemic before. I do want to give a quick overview, just very quickly, of who is in that task force, so that when you think about that, this is a consensus-based piece of legislation. You can see the import of that as we rely on experts from all over the field of addictions and recovery. So a bipartisan group of legislators, medical experts, doctors, pharmacists, state regulators, treatment professionals, the recovery community, judges, and many, many more. Our meetings are open to the public, and we do solicit opinions from all walks, which is something that's been very helpful for us. So here's a quick overview of the package that we have for 2019, our comprehensive legislative package. And I'm going to go through each of these in a little bit more detail, but just to kind of give you a roadmap for what we're going to be talking about. Our first, and I was very pleased to follow Ms. Wheelock in discussion about addiction as a chronic illness. That is central to our legislation, the declaration of addiction as a chronic illness. I'm going to talk to you about a pilot program that is specifically aimed at pregnant persons that are suffering with substance use disorder and keeping families united. We're going to talk about treatment providers and what the treatment community is asked to, for us to help them with, to bolster their ability to have conversations about payment parity and the provision of service that is a higher standard of care. We'll talk about continuity of care with the Department of Corrections and a few technical fixes. And I realize my time is short. I will be going through this very quickly. So I
one bill.
I'm sorry.
This is all in one bill.
Yes, Mr. Chair. This is all in one bill. First up is the declaration of addiction as a chronic illness. As the members of this committee know, Governor Brown declared addiction a public health crisis in Oregon in 2018. This follows up on that and really sets the table for our conversations going forward and clarifies the legislative intent. All of the science is showing us that this is the direction we need to go in. And one of the statistics that I like to throw out is that when we look at the relapse rates for things like hypertension and diabetes, they roughly correspond with the relapse rates for substance use disorder. So it's high time we start treating this like the medical condition that it is, and declare addiction as a chronic illness that is appropriately treated within the medical systems. The Project Nurture pilot program, this is the program that I mentioned that is aimed specifically at pregnant persons that have substance use disorder. I'm very excited about this program, particularly because of the way the statistics bear out its efficacy. What this program does is it pairs folks that suffer with substance use disorder with a peer mentor and a doula, preferably somebody that is dual certified in both of those categories, that can walk through the process with them from the moment they enter into the program to giving birth to, very importantly, 1 year of aftercare after giving birth. And what we're finding is that 93% of participants in these programs stay united with their families. This is an incredibly powerful statistic and shows just how much of an impact we can have with a program that is crafted the right way, aimed at reducing stigma, aimed at providing support, and making sure to provide the appropriate level of care. And this is based on a health share program called Project Nurture, which is why it's been called the Project Nurture Pilot Program. This is a $5 million ask, and it is aimed at 4 counties currently. And we have not picked out 4 counties. We're One thing I do want to stress here, though, is that we want to make certain to leverage these dollars in places where it's needed the most. So we're looking at rural communities. We're looking at communities that don't traditionally have access to these types of programs for where we're going to leverage the dollars for. Next up, accreditation for treatment providers. I have been incredibly fortunate to have a number of treatment providers on the Opioids Task Force, Cascadia, CODA, that have been instrumental in crafting our recommendations, and we asked them what we could do to support them. What we were told was that coming up with a scheme for accreditation for treatment providers would help with the staggering attrition rates that we face in the treatment sector, would help raise the standard of care, and really bolster the treatment community's hand in going to the table asking for payment parity. So what I want to stress here is that this piece of the legislation has to be done the right way, and we've indeed tried to do it in a way that is not going to create any undue barriers. Of course, putting accreditation provisions in place could potentially have the effect of making it even more difficult for treatment providers to come online, and we already have a problem with that. That is absolutely not what this is aimed at. Rather, this is aimed at putting a group of professionals together from the treatment community with a sunrise 2 years out in the future to come up with these accreditation standards and to appropriately have an on-ramp for it. So the idea is that the health authority will convene a group of experts on this topic to come up with the accreditation standards that will be 2 years out. Next up, you all will likely remember House Bill 3440 and the elimination of prior authorization for the first 30 days of entrance into treatment for opioid addiction. You also will likely remember in House Bill 4143, which came through this committee last session, we commissioned a study from DCBS concerning the barriers to accessing treatment. And I do want to say thank you to Rick Blackwell and his team for a fantastic report that has informed our decision-making process for the 2019 legislative package. One of the things that was pointed out was that this prior authorization for private insurers has not been extended to public payers, and that's something that we want to look at as well, because obviously there's a big portion of the population that would capture. But of course, because this is traditionally the purview of the Health Evidence Review Committee, we also want to do it the right way, and so the idea is that we will ask the FERC to study this. And so this provision will say to the FERC, we need you to take a look at this very important issue and take a look at whether we should eliminate the prior authorization for public payers for the first 30 days. The idea is we want immediate access to treatment. We want folks getting into treatment as fast as possible. Another big piece that has come up in the interim has been a discussion around the Department of Corrections, which we've been pleased they've been able to join us in the task force, and what we can do to raise the provision of care within the Department of Corrections, to keep continuity of care, and to also make certain that we are diagnosing and treating folks that are in the custody of the Department of Corrections. Of course, this is a giant endeavor, and so what we're asking is that the Department of Corrections work with community corrections, work with the counties, and to come up with a plan going forward. This is looking into the next biennium budgets, 21-23, for how to keep a continuity of care and also make certain we're appropriately diagnosing and treating individuals within the custody of DOC. And I realize I'm going through this very quickly, but my time is short.
Please continue quickly.
Yes, thank you, Mr. Chair.
It's a very important topic.
Thank you, Mr. Chair. There are also a number of technical fixes within this bill as well. One of these, and again, I'm very pleased to come up on the heels of Ms. Wheelock, who brought this up to my attention about needle exchange programs that need to have an affirmative defense in the statute to possession of controlled substances to make certain that folks that are operating needle exchanges lawfully do not have criminal liability for doing so, and to give them the support there. So that's in there. And I have included this in sort of a technical fix capacity because we're not seeing these prosecutions now, but really we need to make certain that the statute is clear.